Blog Talk Radio.
Join BluPrint Radio each Tuesday, 7 p.m. Eastern. BluPrint Radio host Gloria Thornwell interviews organization leaders on trends and best practices in business and human capital management, business and human resource leadership, and being a change champion in the new global business economy. www.blogtalkradio.com/BluPrint LLC.
Hello, and welcome to BluPrint Radio. BluPrint Radio is a division of the BluPrint Leadership Institute, and on the BluPrint Radio show, we interview organization leaders and change management professionals who are subject matter experts in human capital management, business strategy, government contracting, and also those professionals who have reinvented and led organization transformation in the new global and changing economy. I'm Gloria Thornwell, Human Resource and Management Consulting Expert, and your BluPrint Radio show host. Our discussion today is Truth About the Affordable Care Act, a.k.a. Obamacare. On the line, we have at least one of our experts on the line. We're expecting another one of our subject matter experts to join us, and as soon as she does, we'll plug her in. But we're expecting Carla Watson and Larry Frazier is on the line, both who will shed light on this critical topic affecting business as well as the bottom line. Carla is a master trainer and Affordable Care Act enthusiast. She studied the Act specifically as it relates to the state of Maryland. Larry is a domestic and international consultant, leadership development consultant, knowledge management, and organizational change professional. And is also an Affordable Care Act SME and understands the law both from the federal and Maryland state perspective. So we welcome you to our show. So let's talk about the Affordable Care Act, or Obamacare. I mean, it's really the talk of the world, of the nation and of the world, and specifically over the last year or so. It's really been the talk here in the United States. And so now that it is the law of the land, I want to dissect it a bit to help our listeners better understand a few key points. So after a short break, we're going to begin our discussion. So stay tuned, and we'll be right back.
Did you know that when you take a BluPrint Leadership Institute course, you can earn credits toward your PHR, SPHR, and GPHR recertification? The BluPrint Leadership Institute is certified by the Human Resource Certification Institute and by the International Accreditation Organization. Earn CEUs in project management, finance, executive development, and in other disciplines that will keep you current as a 21st century business leader. Register today. www.bluprint-llc.com.
Welcome back to BluPrint Radio. Again, I'm Gloria Thornwell, your BluPrint Radio show host. Our discussion topic today is Truth About the Affordable Care Act, a.k.a. Obamacare. And on the line, we have one of our subject matter experts. We're waiting for the other to dial in shortly. As soon as she does, we'll plug her in. So, Larry, we are going to begin our discussion with you. Larry, are you there? Can you hear me? Are you there?
Yes. Can you hear me, Gloria?
I can. We can hear you just fine. Thank you. So,
thank you. I want to say thank you to you, Gloria, and also to Carla, and also just a quick thank you to all the listeners out there this evening. So, thank you for their time as well.
Thank you, and we're so glad to have you on the line. So let's start. So let's talk just briefly about eligibility for the Affordable Care Act. So is anyone eligible even if they have pre-existing conditions? Can you talk about that for just a minute?
Well, yes, thanks. That's a great question. There has been a lot of conversation out there about a number of the new changes with the law. And this particular question is one of those questions where people have been asking a lot of questions relatively. But one of the first components of the new law, if we recall in 2010, was that individuals could no longer be denied coverage or actually be forced to pay any exuberant rates for their health coverage. This is one of the things that the Obama administration, they really wanted to push this with the new law. And, people have come down on both sides with it. But no, it's you cannot not actually lose your eligibility. And also, about one of the things that they found is that about 70% or even more in some cases of bankruptcies have been linked to large medical bills. So this is one of the real incentives for people to not use their law. Yes.
Absolutely, absolutely. So tell us about some of the conditions that your company, can't discriminate against, a potential person for. So list some of the pre-existing conditions that are now, you can now have, get a plan even if you have these medical issues.
Well, there are a number of pre-existing conditions that sometimes, could actually run your coverage up. One of them comes to mind if you have any heart disease or any heart ailment, and that comes out in a screening for an insurance, that could actually drive your costs up. Sometimes pre-existing conditions around cancer or asthma or high blood pressure is another area. Particularly high blood pressure is another area that really could drive up your costs. Arthritis is another.
Absolutely, absolutely. So the other question I have is, is it true that one has to, for lack of a better phrase, get rid of their current health care coverage and purchase a plan? In other words, are they required to purchase a plan under the Affordable Care Act? Do they have to get rid of their current plan? What's the answer there?
Well, another great question, Gloria, because a lot of people have this question. There's a lot of conversation about that. I'm sure the viewers have seen a lot of commercials that have given a lot of mixed messages out there. It's gone from CNN to pretty much all the news outlets. But really, I want to say maybe around as of September the 23rd, same year, 2010, all new health plans had to meet the Affordable Care Act, the kind of what we would say are minimum essential benefit requirements for preventive care services. Now, if you had an existing plan, or if you had a plan, and if your plan did not meet some of these minimum requirements, then yes, your plan had to be changed to ensure that it met these requirements. This was important in the plan itself, that it met at least these minimum essential benefit requirements.
Absolutely. So talk a little bit about, making it more affordable. I know that there have been, some tax credits to make it easier for the middle class to afford the insurance. Can you talk a little bit about the affordability?
Now, when you say affordability, I'm sorry, could you repeat the question there?
Sure. So I know some tax credits that, are there to make it easier for the middle class to afford the, Affordable Care Act insurance. And so I think it's available for people with income between 100 and 400% of the poverty line. And I think in 2010, I researched that 400% of the poverty line comes out to about $43,000 for an individual in terms of their salary, or $88,000 for a family of four. So as I understand it, the tax credit is advanceable, so it can lower one's premium each month rather than making the person wait, for tax time. So it seems like that it's refundable, so that even moderate income families can receive the full benefit of the credit. Is that correct?
Yes, and I'm glad you summarized that. But that was the idea of the plan, to actually increase affordability and increase access, so that more people were actually covered. And Maryland, as you know, is a very aggressive state in that matter, to ensure that more individuals are actually covered with the new law.
Absolutely. And then for states that have not opted into the plan, they can use the federal plan. We've heard a lot about that on the news, but they have the option of using the federal plan through healthcare.gov. Is that right?
Yes, and I'm sure there have been a lot of discussions about some states who have not maybe embraced, we want to say this word, embraced, the plan as much as other states have. As we said, Maryland has been one of the more aggressive states in the union in embracing the plan, and we applaud that as Maryland is here. But you're exactly right. Some states, if not, then they'll go through the federal exchanges. Exactly.
Sure. So let me ask, this is one of the questions we didn't ask up front, but, can you explain kind of what the Affordable Care Act is? And I know it's informally known as Obamacare. It was signed into law back on March 23rd of 2010. And so the aim of the act, as we mentioned before, is that health care would be available to everyone in the United States so that no one goes without health insurance. If you notice that people who are sick can't work. They can't work, that leads to a poor economy. And so this law, which is now the law of the land, was put into place so that everyone could have access to quality health care. Did you want to kind of piggyback on that a little bit in terms of what the Affordable Care Act really is and how it's defined?
Well, I'll talk about it and kind of lead it into one of the questions that we have here as it relates to for women. Really, the goal of the Affordable Care Act really is to bring in the idea of affordability and to increase access.
Yes.
In particular, for example, women. Women really benefit from this. Is very in a number of ways, particularly as it relates to preventive measures.
Yes.
Breast cancer screenings come to mind in an effort to screen for breast cancer screenings more aggressively. Another very controversial issue is in which we are still kind of looking at this, is the idea of contraceptions and whether or not those should be covered through federal dollars. Additional services for pregnant women. But the idea is to move into the more individuals have access and move into more preventive care. The goal is that if we could have more preventive services, if we can have this is what at the end state, if we could have more preventive services, is that we would drive down actual costs to the government because individuals would at an earlier date be able to screen for very, very important healthcare services.
Absolutely. And, women, we all know that women often are charged more than men for the exact same health coverage, right? Which is pretty, really honest, it's discriminatory. And so as women, we've had to pay higher premiums and higher out-of-pocket costs. And then, so there's this law called equal pay for equal work. That's the law, but it doesn't always happen. So women tend to make less than men, and we have a harder time many times paying for health care costs. So it seems that, the health care industry discriminated against women just because we're women, just because we're female. So as a result, we've not always had access to the health care that we've needed or the freedom to make the best health care choices for ourselves and for our families. So I'm really just elated that all that's changing now, and that the new healthcare law, this new healthcare reform, healthcare initiative has, it requires the health plans and insurance policies to cover recommended preventive services at no additional cost. So what that means for women is that go ahead.
No, I was going to say, Gloria, you're hitting some very important points and bringing up, I think, some very timely points because, we have more women are entering the workforce today. And that rate is only going to project more aggressively to have more women in the workforce. And so when you think of that, how the actual plan benefits more women, I think it's very timely in that sense that the Affordable Care Act is being rolled out at a time when we have more women going into the workforce than ever before.
Absolutely, absolutely. And, and starting this year, a woman can't be denied coverage because, she's had breast cancer, depression, or even is pregnant. And it's amazing to me that health insurance discriminated against women, because they're pregnant. I mean, pregnancy is not a disability. So it's kind of amazing to me. But, again, we're looking at, charging, equal, prices for equal services. And so, in fact, the current estimates show that at least 8.7 million women will gain maternity coverage because of this new health care reform. And in addition to that, I think I read that there's an estimated 62 million Americans will gain expanded coverage of mental health and substance abuse disorders under the Affordable Care Act. So, this is major, and it's never been done before. So it's really groundbreaking, and I understand, and we all understand there are going to be some changes as we move along, but we had to start someplace. So I'm glad that it started. It started this last year, actually.
Yeah, I mean, if you look at it, more women will have access to maternity coverage, for example, which is very, very important, and care for newborns that can be very costly. In fact, as you were talking about, estimates show that at least over 8 million women will gain maternity coverage because of the new health care law. And that's very, very important, I think.
Oh, yeah, absolutely, absolutely. So we're going to take a short break, and we'll be right back. So hold tight, and we'll be back in just a few seconds.
Did you know that when you take a BluPrint Leadership Institute course, you can earn credits towards your PHR, SPHR, and GPHR recertification? The BluPrint Leadership Institute is certified by the Human Resource Certification Institute and by the International Accreditation Organization. Earn CEUs in project management, finance, executive development, and in other disciplines that will keep you current as a 21st century business leader. Register today. www.blueprint-llc.com.
Hi, we're back, and I'm Gloria Thornwell, your BluPrint Radio show host. Today we are discussing the Affordable Care Act, truths about the Affordable Care Act. And on the line we have Larry Frazier, who is a subject matter expert in the Affordable Care Act, in particular as it relates to Maryland. Larry, one of the other things that I wanted to talk about briefly is, again, kind of who can be covered by the plans. And as I understand it, so there's two mandates, one for individuals and one for businesses, right? The individual mandate requires that all individuals not covered by an employer-sponsored health plan or Medicaid or Medicare or other public insurance program, they'd be eligible to secure an approved private insurance policy. So that the law includes subsidies, right, to help people with low income also comply with the mandate. So the health insurance exchanges, will commence operation in every state that opted in. And then, of course, for those that didn't, they can, then it falls to the federal mandate. But each exchange will serve as an online marketplace where individuals and small businesses can compare policies and buy insurance. So I think the open enrollment for the exchanges began in October 1st of last year. Is that right?
Yes. I mean, you kind of look at it and you kind of pointed to that point. Any individual, there's an individual mandate out there that requires all individuals who are not covered by an employer or a sponsored health plan, whether that be Medicaid or Medicare or other public insurance programs, to secure an approved private insurance policy. And this is something you just kind of pointed towards, which is very, very important. Now, the law also includes subsidies to help people with low incomes to also comply with this mandate. And there's been some discussion about what that date is, whether that open enrollment, open enrollment on the exchanges, whether that will run from October 2013 or whether or not that date has been moved back.
Right. I think most of the exchanges open, or some of them at least open. I know Maryland's open specifically October 1st for the individual mandate. And so now Maryland is preparing for the businesses. And so, in the businesses it's called SHOP, the Small Health Options Program. So the shops will open very soon. In Maryland, it's the Maryland Health Benefit Exchange. Is that right? That's the name of the Health Connection in Maryland. Is that right?
Yes. And, different states, as the viewers may be aware of out there, different states have different names. I mean, if it's in Utah, it's not necessarily Maryland Exchange. If it's in Ohio, it has different names. So different states have different names. But the actual goal is the same, and to increase access.
Absolutely. So can one purchase a plan through their insurance agent, or do they have to go through an exchange? Like, do they have to use an exchange, or if I have an agent that I like to work with, can I just go to him or her and purchase, a new plan?
Right, yes, you can work with your existing agents. If you have a plan, you can work with them. Now, that's a collaborative effort, but yes, you can work with them if you have an existing plan, and that plan meets those, as we said earlier, some of those minimum essential benefit requirements.
Right. Absolutely. So small businesses who have a broker, so for instance, with BluPrint, if we have a broker that we prefer, to partner, we can do that and still purchase a plan or plans for our employees without going through the exchange. Or the other option is, we can use the exchange. So that, and there's a lot of discussion about that, a lot of confusion. So I'm glad that we're able to clarify that. And then the next sort of point of confusion for some people were the exchanges. So they wanted to know, what are the exchanges? And I think that's also a very important item. And so correct me here, Larry, if I'm wrong, but I think the exchanges, are, it's an online marketplace where people who without insurance can, purchase the coverage and possibly with the help of a tax subsidy, again, based on their income level. So in short, it's a place for consumers to shop for health insurance with the assurance that they're going to get a quality product with a guaranteed level of benefits. And in terms of the benefits, I think there are, at least in Maryland, I think it's national as well, there are four plans, four levels. Is that right?
Yes. Moving from the bronze to the actual gold. And also something that you said that was important is that for the viewers to keep in mind is that it's a free marketplace. So individuals are purchasing health care in a marketplace. And so you're exactly correct. We refer to them as exchanges, but it's a free marketplace, and that's important for the viewers to keep in mind.
Right. And, this is kind of a joke. I love the word shop. Women, we love to shop. So, we can shop for cheaper plans and better plans that might make us a little bit more excited about visiting the exchanges. But there are four levels of the plans, and I think you mentioned that there's the bronze, the silver, the gold, and the platinum.
Platinum.
And then as I understand it, the higher the metal, the less you pay for each individual service. But your out-of-pocket maximum you pay in a year for covered services remains the same on all plans. So I think that is a critical point.
Yes. Mm-hmm. Again, as you were saying, from the bronze to the platinum, and I think you just said that.
So for people who are ages 55 to 64, what does the marketplace mean for that group, ages 55 to 64? Well,
that's an important group, as the number of Americans between the ages of 55 and 64 is expected to increase actually rapidly as the baby boomers near retirement. making coverage for this group an increasingly important issue. As baby boomers move towards retirement in huge numbers, you'll figure between that time is over 80 million baby boomers. And the reform of what the actual law for them will guarantee that older adults who no longer have coverage through their employers will be able to get higher quality, affordable coverage through the exchanges. And so insurance companies will be required to sell coverage with comprehensive benefits to each of these individuals, regardless of their health status or their age.
Excellent, excellent. So, again, in summary, everyone has the ability, to be covered. So, a healthy, America, really means a healthy economy. And I have a short, kind of a story to share, and that is I wish that the Affordable Care Act were available and around several years ago. I actually had a sibling to which this act would have been a great help. So he lost his battle with kidney disease even after transplantation. And so, in fact, I was his donor. I donated my kidney to him. And so while my costs were covered because I was the donor, my sibling had many, many out-of-pocket costs in relation to pre-existing conditions and otherwise. And so the health insurance plan that he had didn't, it just didn't cover everything. And so, people, and thank God this didn't happen to him, but people, I think you mentioned this before, Larry, that people, can go homeless paying medical bills and medical costs. And so, when it's high enough that you have to decide, to pay your rent or your mortgage or, take care of a medical bill, that's a pretty tough decision. And so I think that the Affordable Care Act. Mm-hmm.
No, I was going to go ahead. I was just going to say, and you can go ahead, that I really appreciate you sharing that. I'm sure the listeners can appreciate that out there. It's really a touching story. And there are a number of stories out there where increasingly, and just recently, and I can't recall the details of it, so I won't really get too much into it, but just at the recent State of the Union, I think the president had offered up for someone to share about the fact that had the new law not been passed and was available, that given the medical condition of one of the individuals who was there, that it would have created some really real financial challenges for them. So you're exactly correct. The purpose of it is to reduce some of those financial burdens as a result of coverage.
Absolutely. And I think that despite the potential changes, and really despite one's political opinion, political affiliation, I think that this is great for the country. And so there are going to be some changes to the plan. We know, to the act, to the law. We know that that's coming. But again, I think it's great in terms of economic development, and quite simply, it's just the right thing to do. Everyone should be able to get affordable and quality health care coverage, no matter if they are if it's a woman or a man or a child, an older person. Everyone deserves good health care. So, to learn more about the Affordable Care Act, BluPrint offers a course that can be counted toward recertification credits. It's an HR professional for your PHR and your SPHR. You can find our courses at www.bluprint-llc.com. And Blue is spelled without the E. It's www.bluprint-llc.com. And once you're there, you click on Leadership Tracks. Larry, thank you so much for your time. Thank you all listeners for joining BluPrint Radio. We hope that you will join us each Tuesday at 7 p.m. Until next time.
Well, thank you.
Join BluPrint Radio each Tuesday, 7 p.m. Eastern. BluPrint Radio host Gloria Thornwell interviews organization leaders on trends and best practices.